So good evening, everybody. Thanks for joining us for this webinar about how faith and community-based organizations can respond to the current COVID-19 outbreak, as well as other pandemics, epidemics, and outbreaks that may affect their communities. On the agenda today, we are going to talk specifically about COVID-19, but we also are going to touch a little bit on other infectious diseases. We're going to work to understand social distancing, isolation, and quarantine. Talk about ways that we can share some social or physically distant large gathering and congregate worship times. Safely continuing those gatherings that are essential, because some of the things that happen in our churches and faith communities and community organizations are all, some of them are essential. As well as how do we support children's, teens, and families, essential, vulnerable, and isolated people, and ways that we can support the wider community. I would encourage you, if you do have questions during this, please use the comment function on the live stream. I am monitoring that, and I will try and answer questions for you as we go along. This is being recorded, will be available through our webpage at RMR Safety, and will be also available through our Facebook page, and I'll share it on my Facebook page as well. So for those of you who don't know me, my name is Matthew Woodall. I am an independent emergency and risk management consultant. That means that I spend a lot of time thinking about how things can go wrong, which means that I have a bit of a unique take on how we can help things get right and be better throughout COVID-19. I'm being told that there maybe is no sound on this. Just a second here while I see, just 1 second here. So if you are having trouble hearing, there is sound coming through on the live broadcast. Just go down to the speaker icon in the bottom right corner of your video screen. Just make sure that there is no X beside that. If you do see an X beside that, just click on that speaker, and that should take your mute off, and you should be able to hear that. So we'll just give a minute here to see if people can get it. Is anybody else having trouble hearing me, or is this, just want to make sure that this is not something that's happening on my end? Not seeing any other comments about sound issues. I'm going to guess that I believe that this is actually just a quick user error. I'm just going to quickly troubleshoot with this person. And so we are back live, and we will keep going here. So as I said, my name is Matthew Woodall. I'm an independent emergency and risk management consultant. I focus very much on vulnerable populations as well as supporting faith-based and community organizations. The goal for me is not to build an empire, but to build more resilient communities and organizations. We want to see everybody become more resilient and to be better able to be prepared and ready for what comes next. Prior to hanging my shingle out on my own, I worked for the provincial government here in Saskatchewan. I was an emergency management consultant with the Ministry of Health, and so was deeply involved with the response to many significant incidents over the past few years. Before working for the Ministry of Health, I was a firefighter, first responder, and dispatcher, so I've worked on the front lines of emergency response as well. I did also serve as a presbytery youth minister, as well as having had different roles in some ecumenical organizations, and I am a lifelong member of the United Church of Canada. So my this really does come out of my background and the things that I have learned over the years through my different jobs about how we can come together as communities. Just so that we're all on the same page, I do want to talk for a quick minute about what COVID-19 and infectious diseases are. It's easy for us to start talking and to make sure that, and to not make sure that everybody has the same basic understanding. So when we're talking about infectious diseases and coronaviruses in particular, infectious diseases are pathogenic microorganisms. Um, what this really means is they're bacteria, viruses, parasites, or fungi. They could be any one of those. The key thing here is that they have to be transmissible. They have to be able to be transmitted between people. A specific subset of infectious diseases is called zoonotic diseases, and they are infectious diseases of animals that can cause disease when they're transmitted to humans. And so these are things, zoonotic diseases specifically are things like bird flu or swine flu or other things that can be transmitted from an animal to humans. Coronaviruses, as the name says, are a class of virus, and they're called coronaviruses because of their shape. They are kind of circular, and so they gained their name because of their spherical shape. Coronaviruses are responsible for some of the more recent severe illnesses that we've seen. SARS, the severe acute respiratory syndrome, MERS-CoV, which is the Middle East respiratory syndrome, and now COVID-19. However, most of us will have had a coronavirus at some point in our life, as they are also responsible for the common cold. It is a very large class of viruses and has a very wide, a wide frame of severity. COVID-19 specifically appears to be a zoonotic virus. It appears to have originated in some type of animal in China. The specific reservoir hasn't clearly been identified. There's been a few different animals that have been thrown out as suggestions for the origin. But we do know that it did originate in China, in the city of Wuhan in Hubei province. And it was first seen in humans in mid-December 2019. What we have seen with COVID-19 is that it's highly virulent. It tends to transmit very easily from person to person, to be able to share very easily. What we do also know is that it's moderately pathogenic. It does infect people to the point of death. It can be quite serious. What seems to have happened is that COVID-19 has hit kind of the pandemic sweet spot, where a virus is virulent enough, can be transmitted easily enough that it infects lots of people, but it's also not so deadly, not so pathogenic that it kills people before they can pass it along. So COVID-19 seems to be kind of the perfect storm for a virus, specifically for a pandemic virus. So what we're talking about right now is we're talking about things about social distancing, isolation, and quarantine. The joke is that this is an ideal circumstance for introverts. As an introvert, being told to stay home and read a book is absolutely my favorite thing. But for some people, that's not their cup of tea. And we really need to know what we're talking about when we're talking about social distancing, isolation, and quarantine, because they are very different things. All of them fall into the category of a public health response. Public health response to outbreaks, epidemics, and pandemics is really focused on these five things. The prevention of outbreaks is the most important. If we can stop something from happening the first time, then we don't need to worry about anything else. Once there is a pathogen that is out there, how do we contain it? How do we keep it from spreading between people? How do we make sure that those who are infected don't end up infecting lots of other people? We also are focusing on the mitigation of health consequences. So when someone is infected, how do we keep that infection at a manageable level so that we're not overwhelming the health system? What are the steps that we can take to make sure that the consequences of that person becoming infected um, are not so severe that their infection becomes a major drain on health resources? As a result, the public health response is also about how do we respond to those infections and to the health systems. What are the steps that we need to take to make sure that once that infection is out there and we're into an epidemic or pandemic situation, what are the things that we need to do in order to be able to make sure that those basic health needs are continued to be met? And finally, once everything is done, the public health response is really going to talk about how do we come back from this and what are the lessons that we've learned from this. Those are all really important things because we need to know how to do better next time. A lot of the talk has been about flattening the curve. And this is a really, this is a PR person's dream. It's a really simple thing to remember, and it gives you a very visual idea. But what are we actually talking about when we're talking about flattening the curve? What we're talking about is we're talking about controlling the rate of transmission and infection so that while we may still have the same number of people who are infected, that those infections happen over a longer period of time. We have seen in recent days um, some panic buying where people have gone out and purchased very strange amounts of different things. And I want you to imagine that instead of people going out and buying toilet paper or milk, I went out to get milk the other day and there didn't seem to be a single jug in the entire city, that we're talking about ICU beds or ventilators or if we get to that point, vaccines or other medications to treat COVID-19. If we have an overwhelming number of people that are infected very quickly, then we will very quickly see a situation like they have in Italy, where right now they are talking about how do they use their resources most effectively to help the most people. That's a very strong, it's a very challenging ethics conversation and one that we're not going to get into. But what we need to know, what we need to remember is that the healthcare system, particularly in Canada and other industrialized countries, has been quote unquote optimized so that there is very little or no surge capacity left in hospitals. So if you see the gray dashed line there, that's roughly our capacity for surge capacity right now. Um, on a good day, we might have um, we there are places that may have there are entire provinces and states that may have 5 ICU beds available in the entire province or state. And just because we are experiencing an outbreak doesn't mean that all of those other things that require an ICU bed stop happening. People still have heart attacks, people still get into car accidents, um, people still end up in septic shock, people still get other infections. All of those things are still happening. And so the challenge is to make sure that we're not overwhelming the health system. And that is why it's really important that we work together as a community and that we work together as a wider group of people beyond just the healthcare system. This really is a whole of society response that we need to do in order to flatten the curve. So when we talk about social distancing, what we're actually talking about is physical distancing. Social or physical distancing is a voluntary activity to reduce in-person interactions. So if you think about your normal day and you think about the things that you do during your normal day, you are going to realize that you are within um, that close contact zone of 1 to 2 meters with lots of people every day. And so what physical distancing and social distancing is trying to do is to reduce the number of contacts between people every day. Because when you do that, it reduces the what are called possible transmission vectors. It reduces the ways that people can become sick. And it makes it easier to trace. So, for example, instead of going out and running dozens of errands, today, if I happen to be sick because I am practicing physical distancing, I can say that at 10:30, I went to my local grocery store. I was there for 30 minutes, and these are the places where I lingered. As opposed to, well, I went to Walmart and then I went to the grocery store and then I went and picked up some stuff at the lumber yard. Um, Choosing to be physically distant from people is really important in helping to flatten the curve, and it's also extremely effective. And it is most effective when um, we implement it early. The earlier we start social distancing, the better the effect will be. But it is something that requires the full support of communities. It is something that everyone has to buy into, or else it's not going to work. When we talk about isolation, isolation is generally voluntary. Um, what's happening now is that people who have traveled are being asked to self-isolate, which is a voluntary measure. No one is forcing them to do that, but they are being asked to do that. Usually isolation is for symptomatic or otherwise vulnerable people. So if you already have the symptoms of COVID-19, you're being asked to isolate. In this case, the authorities are also asking people who have traveled who may not be symptomatic to isolate because of the science behind it showing that people may be able to transmit the infection unknowingly while they are not symptomatic. The other groups of people that are being asked to isolate are vulnerable people. So those who have pre-existing medical conditions, those who may be elderly, those who, for one reason or another, are going to be more vulnerable. Isolation tends to happen for a definite amount of time. So as we're seeing right now in Canada, people who are returning when they're being asked to self-isolate are being asked to self-isolate for 14 days. What this means is that they're looking for limited to no contact with other people. That's not always possible, particularly in families, but they're looking for people to regulate the contact that they have with other people to, again, to minimize that possibility of transmitting the disease, whether you have it or not. This is a self-regulating function. This relies on the person in self-isolation or in isolation to follow the rules on their own. When we talk about quarantine, quarantine is actually a legal description. It's a legal action under the Public Health Act or whatever specific act is applicable in your jurisdiction. Quarantine is, by and large, generally reserved for people who are not compliant with isolation. If someone is voluntarily isolating themselves, there's not really a need to quarantine them. However, people who are choosing to violate the isolation may end up subject to an order of quarantine by the chief medical health officer. This is essentially mandatory isolation and is actually enforceable by law enforcement. If you are under quarantine and you break that quarantine, you can be arrested and you can be charged. In Canada particularly, this is an option of last resort. We do not want to quarantine people against their will unless it is absolutely necessary. Um, but those three things are very different. Social or physical distancing, isolation, and quarantine. So there was a question about what exactly surge capacity is. So when we're talking about surge capacity in the health system, it's the health system's ability to absorb a larger number of patients than is normally expected. And it could be because of a bus crash or a plane crash. It could be because the potato salad at a wedding was bad and now everybody has food poisoning or something like that. Um, It could be because we are seeing a particularly bad flu season or a pandemic like we're seeing with COVID-19. So surge capacity is basically those beds that are sitting empty in the hospital, ready to be used for people who need it. We have politicians and others have begun to cut things so that it is challenging for hospitals to justify why they have beds sitting empty. However, when we really need them, then it becomes very important. So what we're seeing now in many jurisdictions in Canada is that in order to preserve the surge capacity or to make sure that we have the beds available to treat potential COVID-19 patients, is that things such as elective surgeries, non-emergency surgeries, all non-emergency procedures, anything that is not immediately life-threatening is something that is being pushed off to preserve those beds so that they can be used as necessary for people with COVID-19. One of the things that sets faith-based and community-based organizations apart is that we like to gather in large groups. We come together and we generally have a really good time. It's lots of fun, and it's an opportunity for us to come together and be community in different ways. But when we are into an epidemic or pandemic outbreak, we have to change those things. We can't or don't want to meet together in person. So when we're talking specifically about faith-based organizations, and I come from a Christian background, so I use Sunday morning worship. However, this could just as easily apply to Friday prayers at the mosque or services at the temple or any other sacred congregate gathering. There are some options that we can use to be able to share this time with other people without having to be together personally, without having to gather in a large group. And the one that we all like to go to right away is our virtual options. Tonight I'm doing Facebook Live. Some people make videos available through YouTube. Some people use software such as WebEx or Zoom to be able to share information through or share congregate services through a webinar. Some of them will stream things through the church site or record them and post them there. Those are all excellent options. However, they are grounded in the concept that everybody has access to high-speed internet. And there are many places, even in Canada and the United States, where access to high-speed internet still is not available. And that makes things like that challenging. And so we need to be able to provide other options. And so one of them may be that we use digital or video options where we record things ahead of time or record things on Sunday morning and then share them by DVD or USB drive or even VHS. There are still some people out there who use VHS. We may choose to do it in an audio format. We may choose to do it by way of a conference call, which allows people to come together and to share in an interactive time of congregate gathering. Or we may choose to do a simple audio recording where we share prayers and the sermon. I know that at my church here in Regina, Westminster United Church, we are also going to be making an effort to include music because that is a big part of our worship. The other possibility is that we may need to choose to use written options. Some people, for whatever reason, and it could be that they have a hearing impairment, it could be that they are blind. Some people may want to receive them, and blind is not a good example because unless you send it out in Braille, that won't be helpful. But for people who may have trouble with technology or may have trouble with videos, they may want to receive a written option. And that could be sent out either through email, could be mailed to them, or we could even make a point of delivering it to their door if we're able to do so in a safe way. when we talk about community gatherings, these are the other things that many people think about when we're talking about faith and community-based organizations. And the one that comes to mind for a lot of people is community meals. Um, and that's the ability to get together and really just have a good time together while sharing in a meal. And there's something special about that. And so gathering right now in community meals and sharing in meals together is not a really good option because we do need to practice that um, physical distancing. But there is the possibility to provide takeout or even drive-through opportunities, and then connect with people virtually, to have people go home and log on to a webinar, or have people go home and share in a meal with their family. You know, for some people, being able to pick up a dinner that they don't have to make and be able to take that home is really something that is badly needed. You may also want to choose to engage safely in meals with small groups of low risk people. So my family and I fall into the low risk category. Um, we don't have any significant risks that would make us vulnerable. And so what we may do is choose to share that meal um, in person with other people who are low risk, trying to keep the number, of course, below that 10, that target of 10 people. And so that is an option to engage in smaller gatherings of low risk people. The other one that happens, and again, this is something that happens quite regularly with my church here in Regina and in other places, is that music, art, and cultural events happen. They will come and they will um, rent the facility. There are a number of churches here in Regina that host some fantastic music throughout the year. Um, what we have decided to do at Westminster is to leave the decision up to our renters about how to do that. Our renters, we're trusting them to make the right decision for their group based on the same information that we have. But we do want to encourage them to support those social distancing and to look at some of those alternative options. And those alternative options may look very similar to what we just talked about for Sunday mornings. That it could be a video, it could be something that they save and they post later. It could be something that they set up. It's even possible to set it up so that you can listen to it on a conference call. There are lots of opportunities here for people to be unique and have unique ideas. What we need to remember about music, art, and cultural events is that they may not be considered essential, but they are still important, and they are just as important or even more important during times like we're in right now. People need to be able to have beautiful things in their lives and to be able to experience those things um, during stressful times, but to be able to do it in safe ways. And so, if there are ways that we can encourage those things to still happen and still be shared with the community in a safe way, we should really try and do that. The other thing that's really important when we're talking about large gatherings is that um, faith-based and community-based organizations can be additionally vulnerable because um, we are open and accepting of people. Um, we don't we don't ask people have they washed their hands. We don't inquire about people's personal habits. We don't ask questions that would be considered personal, but are sometimes might be essential that we would ask perhaps our family members. We can't blame people for their background, their cultural upbringing, but what that means is that we as leaders have to take additional precautions and make responsible decisions, so that if we are keeping our buildings open, if we are doing some type of gathering in our buildings, we need to make sure that we are doing the appropriate cleaning, that we are doing the extra bits of work to protect everybody, simply because we can't necessarily rely on everybody to be protecting, to be following the best guidance. And it may not even be a cultural thing. It may simply be that they don't have access. For people who are homeless, living in poverty, some of that stuff may not be as readily accessible or easily considered as it is for those of us who um, are much more fortunate. There are, however, some essential gatherings that should still happen. One of the things that we need to recognize is that some of the gatherings that happen in our buildings may actually be lifesavers. They may actually save somebody's life. So some of these are supportive gatherings, and these are um, things that, as I said, are potentially life-saving meetings. Um, and this is particularly applicable to vulnerable or marginalized populations. I'm thinking of recent immigrants, people who may be new to Canada, new to the community, and for whom the opportunity to get together once a week is the only chance that they have to talk with people from their own background, to be able to share life together and share in those important things that they do. Um, Another one would be anonymous groups. So Alcoholics Anonymous, Narcotics Anonymous. For many people, those are actually life-saving programs. I have had a chance to talk with many people who've been through those programs, and without the regular support that they receive through those, many of them would have relapsed. Um, we also need to consider, and we are going to talk about this a little bit later, that for children, youth, and young adults, there may be a need to continue some type of supportive gatherings when it's safe to do so. We're going to talk specifically about children, youth, young adults, families, those groups a little bit later. But it is something that we may need to consider, that may want to consider continuing those gatherings. And the other one is mental health groups. For many people, this is an additionally stressful time. People who are living with mental health conditions, mental health illnesses, may need additional support to get through this. So for these supportive gatherings, what they should be doing is they should be assessing their risk. Do they involve vulnerable people? Do they involve people who have recently traveled, particularly if they've traveled to affected areas or been in contact with people who've traveled to affected areas? They need to assess the risk, and they need to make a decision about how best they can support those gatherings. The other piece that will need to continue is the leadership and continuity piece, specifically for the faith or community-based organization. Every faith-based or community-based organization should have an emergency preparedness advisory team. And this should be a group of people whose job it is to prepare guidance and advice based on best practices and the information that is available, and be able to provide that to the core teams, the council, whatever you want to call it, that this emergency preparedness team would specifically be there to advise the church, the council, the congregation on how best to prepare, both during ongoing emergencies such as COVID-19 and in other times when there is nothing happening. Church council or other senior leadership may need to continue to meet. There continues to be decisions that need to be made, and so they may need to continue to meet. The other group that may need to meet is the faith leadership, and particularly in situations where there is shared leadership, it is important for those people to continue to share life together, to share responsibilities, and to be able to support each other in a time that is incredibly stressful for many people. The other piece of this is that it is really important for faith-based and community-based organizations to have some type of continuity planning. And this isn't something that we really like to talk about. It isn't something that we're very good at planning for. But we need to be thinking about what happens if. So what happens if our minister happens to become sick with COVID-19? How do we continue supporting our congregation and the faith needs of our congregation um, when our faith leader isn't available? Um, what about our lay leadership? If our council becomes sick or otherwise incapacitated, how do we make sure that the decisions that are necessary to keep the church running or the organization running, how do we make sure that those conversations continue to happen? This isn't something that churches and community organizations have always considered, but it is something that is going to be really key and is becoming more and more important as we begin to see the effects of climate change and additional we're seeing stronger and more frequent natural disasters as a result of climate change. And so it's only a matter of time before churches are confronted with the question of how do we continue providing services if. Talked earlier a little bit about children, teens, and families, and there is some very specific needs that come with supporting children, teens, and families. And it's around building resilience, supporting their health, and supporting the mental health. And that last piece is really important. So we're in a situation now where schools across or around the world really are closed. And for a lot of children, especially people who live for children who live in high risk areas, children who live in poverty, children who may be parts of families experiencing homelessness. School is often more than just education. For some kids, this may be the only place where they get a hot meal. This may be the only place where they can access any type of preventative health care. This may be the place where they go to get their emotional and social support. School is more than just education, and when we don't have um, access to the schools and the school system, then as faith-based and community-based organizations, we need to step up and to be able to support those people and those children when those things are missing. Some of the things that we can do in order to support that are look at what does it look like for a faith-based or a community-based organization to provide low or no-cost meals in high-risk areas. Here in Regina, we have a neighborhood that is home to all sorts of marginalized people and a place that would be considered very high risk, where there's lots of people living in poverty. And a lot of those kids rely on school to meet a lot of their needs. So what does it look like for an organization in that area to partner up with a local grocery store, with a local restaurant, to be able to provide low or no cost meals that the kids can come by, pick up, and take home with them. And at least they still get that meal. When it's appropriate, faith and community-based organizations may also be able to do things like provide transportation to healthcare appointments, that they may be able to provide childcare well. So if a parent or both parents have to take one child to an appointment or for a healthcare um, any type of healthcare need, that someone from the church may be able to provide childcare. And this specifically works well when we have access to teenagers and young adults who don't have who don't have school themselves, and so they are able to provide some of that. And so the churches in the church, faith-based and community-based organizations are in a unique position to be able to connect those needs. The other thing that faith and community-based organizations can do is to set up unique opportunities for people to get outside. It could be a photo scavenger hunt. It could be geocaching. Just because we are practicing physical and social distancing doesn't mean that you can't go outside. You are not housebound because you are physically distancing yourself. Um, so churches, faith-based and community-based organizations can provide unique opportunities for people to get outside and learn more about their community. What does it look like for a faith-based or community-based organization to set up a photo scavenger hunt that takes people around the neighborhood and says, let's find this, go find the little library and give me the name of 3 books, or take a picture of the little library on this corner. There are all sorts of things that we can do um, uh, to support children and teens and young adults when they don't have access to the educational system. It's really important that we address the emotional and mental health of children, teens, and young adults during disasters, whether it be a pandemic like COVID-19, whether it be a wildfire, whether it be a community tragedy such as the Humboldt Broncos bus crash. Children and teens need additional emotional and mental health support. One of the things that faith-based and community-based organizations are able to do is they often have access to people who will be able to have an age-appropriate conversation about COVID-19. Um, I am incredibly blessed. I have a wonderful six and a half year old, as she keeps telling me, who we are able to talk quite openly. And so we had a bit of a conversation today. She came down as I was working on getting this webinar ready, and we talked a little bit. And I was able to say, we are helping people figure out how to love each other and care for each other, even when times when they can't reach out and hug each other. And it's not that we are scared about getting sick. It's that because we're healthy, we need to do our part to make sure that we don't accidentally spread the coronavirus to other people. Um, it's an age-appropriate conversation, and she was able to understand it, and she said, "Okay, thanks, Daddy. Can I go swing in my hammock now?" Um, but it's important that we talk about these things and address the elephant in the room. Kids know that something is going on. My daughter's 6.5. She is able to tell me what's going on about the coronavirus. She was very excited when she came down today to tell me about how, because the people in Italy have been in quarantine, that the animals in Italy are coming back. And so she is aware of what's going on, and if she's aware at 6, then they're aware at 10, and they're aware at 14, and they're aware at 18. And so we need to be able to have those conversations with them and to be able to share with them what is going on in an age appropriate manner. We need to be able to acknowledge to them that fear is a normal reaction. Um, I do this professionally. I have been dealing with COVID-19 for months now, back to when it was known as the unknown Wuhan pneumonia. Um, I will freely admit, this one scares me. This has the potential to be a very bad situation. And so we need to acknowledge that fear is a normal reaction to what is happening. When we have these conversations, though, we need to make sure that they're on their terms and not on ours. Just because we want to talk about something doesn't mean that they're ready. So we have never hidden anything about COVID-19 or the coronavirus from our daughter. We have had these conversations. We certainly haven't tried to shelter her from anything. And when she was ready to find out a little bit more, she came to us. And so we were able to engage on her terms and not on ours. Some of the things that we can do, though, are to encourage safe, regular contact with family and friends. And I'm incredibly lucky. I have my daughter has two sets of grandparents who regularly check in, who talk to her and find out how she's doing and engage in life with her, and do so virtually because we are, a good day and a half away from them. Um, and so we are able to practice that safe, regular contact with family and friends. We also are able to, in conversation with some of her friends and the parents of some of her friends, we're able to say, you know what, yeah, it probably would be okay for the two of them to get together and play, and to be able to keep some sense of normalcy. The other thing that we can do for children and teens is that oftentimes we will have um, um, professionals within our social circle who will be able to speak to this, and whether, especially when parents aren't comfortable talking about it themselves, and whether it be psychologists or social workers or youth ministers or pastors, that there are professionals that we would have access to within our social circle who'd be able to talk about this with children and teens, and to be able to put it into the appropriate context for them. One thing that I've seen posted on social media recently is the idea of quarantines. And these are groups of people who live in close proximity, are at low risk, and so they get together to kind of break some of that isolation, to break some of that social isolation that happens when we're practicing physical and social distancing. And they do that in a safe and controlled manner with people who are at low risk. One of the things that we really need to do for our children and teens is that we need to help them build resilience. Children and teens have a role in helping faith-based and community-based organizations respond to this. Building some of those intergenerational contacts is really key. I was talking with a minister earlier today about some of the things that they are doing at their congregation, and one of the things they said is that they're they're having the 10-year-olds call and check in on the seniors, because that gives the 10-year-olds some ownership and um, the ability to take a little bit of control over a situation that they have no control over, and to be able to have a little bit of agency, no matter how little it is, to be able to control their own lives right now, and to be able to make a difference for other people. So when it is appropriate, there are some appropriate supportive tasks that they can help with, and that may be some of that regular contact with isolated and vulnerable people, by over the phone, or if it's a well-known neighbor or somebody that they're very familiar with, or a family member, to even stop in once a day or once every other day, and just check in and say, how are you doing? They may be able to support the delivery of meals, outreach material, guidance from the government, or some of those faith-based, those printed or digital faith-based options, that people will want in order to stay connected. When we're looking to build resilience in children and teens, one of the things that we really need to do is we need to celebrate the little supportive actions. So it might be that they talked for 3 minutes with somebody, but that is something that we need to celebrate because they are engaging and being part of the community and being part of the organizational response to making sure that people are happy and healthy, and as safe as possible. And the other thing that we need to do with our children, teens, and young adults is to enjoy the little things. Um, so we're on day 3 of no school here, and so My wife and daughter and I have, my wife and daughter had a great time making me a cake for my birthday yesterday. It wasn't anything major, but it was a little thing that they could do together that they really enjoyed, and it was something to celebrate and to enjoy. Moving on to how do we support those people who are essential, people who are vulnerable, and people who may be isolated. And whether that is because they are self isolating or whether that is because they simply don't feel safe going out, that is, those are the people that we're talking about. So when we talk about essential workers, many essential workers need additional support. A lot of them are single parent families or they are in situations where both parents are essential. I can't tell you the number of firefighters who are married to nurses and police officers who are married to doctors and are in situations where both parents are considered to be essential staff. The other thing to consider, especially during pandemics, is that a lot of those caring and helping um, jobs tend to fall to women for one reason or another. And in many cases, single parent families are led by women. And so they need additional support. And so there are things that faith based and community based organizations can do. And some of that is, as we've talked about, meal prep and delivery. And this doesn't have to be fancy, but if you're able to do it safely and in a way that complies with public health legislation and regulations right now, what does it look like for you to make for you to make up 20 for the organization to make up 20 casseroles or 20 dishes of lasagna and deliver them safely to those essential workers? For many essential workers, not having school is a big issue because it means that they don't have access to child care, and so they need to um, make some make some very hard decisions about do they stay home for their family or do they go and support their coworkers in doing those essential tasks. So one of the things that faith-based and community-based organizations are able to do is sometimes to um, pair up those people that may have the ability to offer childcare with people who need childcare. And again, we're not talking about having 400 kids come together or 100 kids or even 50 kids come together. This would be a matter of someone who is appropriately trained and screened for working with vulnerable people to go and provide child care to one or two or three or four kids of an essential worker who needs to be at work so that they can continue to earn money and to support the whole of society response. The other thing is that faith-based and community-based organizations who have essential workers will have the ability to know what those people need, and there may be different personalized needs, and it may be that there are all sorts of things that it could be, but that they are able to meet those personalized needs in a way that isn't possible in other ways. And so faith-based and community-based organizations become very important for essential workers. When we're talking about vulnerable, isolated, and quarantined people, we're really talking about those who cannot or do not want to go out. And there are things that we can do in order to support that. If we're able to provide grocery and pharmacy deliveries. And it's as simple as talking with the person and saying, what do you need? If we do things like this, we need to make sure that we are behaving and working in ways that are safe for both our volunteers who are doing the shopping and for the people who are needing the supplies. And so we're not going to go and ask somebody for their debit or credit card, but we are going to use gift cards whenever possible. And if faith-based and community-based organizations are doing things like that, that they work with local organizations and people who may have access to funds to get donations of those gift cards. One of the things that they can do, and this is especially helpful in smaller congregations and places that may not have the ability to do some of these larger things, but simply to do regular check-ins. And whether that be virtually by talking over email regularly or a quick phone call to say, hey, how are you doing? What do you need? Is there anything that we can do to help you? And this extends to people beyond just those in the faith-based or community-based organizations. This is something that can go to, I happen to know that Betty down the street doesn't have any family, and so I'm going to go and check in on her. She doesn't go to my church. She's not somebody I know other than, she happens to be a neighbor. And so I am going to make an effort to check in regularly. And if I can't do it, then I'm going to make sure that somebody from my faith-based or community-based organization is able to do it and to check in regularly with her. The other thing that we can do, especially now as we're getting into spring and the potential that this may continue in for a number of months, is that we're able to provide some safe support around homes for those who cannot go out. And so that may be things like snow clearing or mowing the lawn, or even something as simple as stopping at the post office to pick up a package for them that they weren't able to have delivered. There are lots of things that we can do, and the limit here really is on what the organization is willing to do and capable to do, and what they feel comfortable and safe doing. So the last thing that we want to talk about is how do we as faith and community-based organizations support the wider, the whole of society response. The reality is we are all in this together, and it only works if we are working together to make this an effective and productive whole of society response. So one of the biggest things that particularly faith-based organizations can do is to provide information sharing opportunities. Communities of faith can be gatekeepers into subcultures that don't necessarily have the trust level or the access to regular government information. They are a trusted source of information. Um, People build relationships and friendships with those leaders and with other people inside the faith-based community. And it may be that they trust those relationships more than they trust a proclamation from a government. There are lots of reasons for this. Some of it can be attributed to false news and what is really a toxic partisan political landscape, especially in North America. But some of it may also because of cultural or personal history with oppressive governments and with situations where information may have been deliberately people may have been deliberately given misinformation by the government or by other people in official capacities. And so communities of faith can provide access to those marginalized populations, become that trusted source of information to share official information and guidance. And this is more than just Facebook and email. This is engaging in conversations. This is mailing out the official guidance or sharing it in other ways that reach places who may not, reach people who may not get their guidance through Facebook or through email or from the internet, that they may require that actual personal touch. So why are we doing this, and why do faith communities and community-based organizations need to take extra precautions? And the reality is that these organizations, because we are open and accessible to people from all sorts of backgrounds, and in many cases a large amount of our population falls into that vulnerable category, whether it be because of age or medical condition. or because they're experiencing homelessness or poverty or living with addiction, that they may be additionally vulnerable. And so it falls to us to be able to take those extra precautions. And they're also, faith-based and community-based organizations are also in a very unique place to be able to reach out. Um, I think of my denomination in the United Church of Canada. We basically have outposts all over the city. We have churches in just about every community, every neighborhood in the city. And so we are able to reach out and be present in many places, and in a much more practical way than perhaps a larger organization such as a government or a health authority would be able to. So faith-based and community-based organizations are really key to the response. With that, I will leave it open for questions. And again, please use the comment function. I will try and answer them as they come in. As it says, I may not know the answer, but I likely know where to find the answer. And so I'm going to work really hard to be able to find this. What you're going to see, and I'm going to share it in. Apparently there have been some questions that I didn't see pop up here. Would holding an outdoor hymn sing be safe as long as people were spaced apart at an appropriate distance? Um, Absolutely. Outdoor, and there's no evidence one way or another about um, COVID-19 and its response to atmospheric conditions. We know right now that it infects people in Italy just as easily as it infects people in China and in Australia and in Canada. So we don't know that outdoor atmospheric effects actually um, affect anything in terms of the virus itself. As long as people are spaced apart at an appropriate distance, I don't see any problem with that. I know that a lot of congregations, a lot of faith-based communities will do that, particularly on Easter morning. Um, so I don't see anything wrong with that. Um, and in fact, it might actually be quite stunning to have a congregation spread out uh, around a grove, around a forest, and have that communication, that hymn sing, um, become kind of a natural part of um, that scenario. So yeah, I certainly would not see a problem with an outdoor hymn sing, as long as there was an appropriate distance, and as long as there was it was within kind of the guidelines as set out by local health authorities. Really important thing that I didn't touch on when we're talking about um, looking after each other, it is extremely important for us to look after our ministers and our leaders. They are being asked to do exceptionally an exceptionally large amount of work that falls outside of their expertise sometimes. They are spending a lot of time counseling people who are anxious, who are worried, and that type of thing. So we need to make sure that we look out for our ministers, our leadership, and that we are giving them the appropriate space and time to be able to do that. Yes, this is recorded. It will be up live. Well, not live. It will be up on our Facebook page. I am also going to see about getting it up on YouTube, seeing if there's a way to do that so that people who don't have Facebook would still be able to access it. If there are questions, if you want to talk more, um, this is yes, this is what I do for a living. Yes, this is my business. But I am more than happy to provide some general advice and guidance to faith-based and community-based organizations around things that they can do. If you're looking to get something more concrete, if you're looking to have a pandemic plan or a continuity of operations plan or emergency management work done, then certainly that's something that I'm more than happy to talk to you about and to figure out how we can do that in a way that is going to not break the bank. At the end of the day, I'm not in this for money. I'm in this to make the community as a much more resilient place. And so I would encourage you, you can either email me at mwoodall, MWOODALL, at rmrsafety.com, or you can visit me online at www.rmrsafety.com. It has been a pleasure. Thank you so much for being a part of this and for tuning in. And we look forward to hearing from you and to hearing your suggestions. And if you try something and it works, or you try something that we didn't talk about, please share it with us. Please let us know. We're happy to share success stories and share the information with lots of people. So with that, thank you very much, and have yourselves a wonderful evening.